Good afternoon. It's my pleasure to be back in Buffalo today. Let me acknowledge some of the guests we have with us. First, our great Lieutenant Governor Kathy Hochul is here. Let's give her a round of applause. We have County Executive Mark Poloncarz, who's done a really outstanding job in fighting opioids and bringing attention to it, which is going to be the main topic of our press conference today. Erie County District Attorney John Flynn. My colleagues from Albany, who are very grateful that they're not in Albany right now. Just kidding. I know you miss it every day. State Senator Mike Rosenhofer, let's give him a round of applause. Tim Kennedy, Chris Jacobs, Sean Ryan, and Angelo Morinello. Good to be with you, gentlemen. We also have Joel Ferroletto from the Buffalo Common Council. Good to be with Joel. Pleasure. And we have the one and only, the inimitable Head of Economic Development, Howard Zemsky. Let's give him a round of applause. Before I touch on today's topic, I'd like to make a couple of points that are timely. President Trump has put out a tax plan, and they are marketing it as a tax cut plan. Tax cuts are always good. You say tax cuts, everybody says yay. Proud that in New York State we cut taxes all across the board. Every New Yorker pays a lower tax rate today than the day I took office. Middle class, up to $300,000, lowest tax rate since 1947. So that's good news. The federal tax cut plan, however, would not in fact cut taxes. It would in fact raise taxes for the people of the state of New York. How can that be? In the tax cut plan, there is a provision that is devastating to New York. The tax cut plan that the federal government put out eliminates the deductibility of state and local taxes, which means what? Right now, you pay state taxes, you pay local taxes, property taxes, and you deduct that from your federal income tax. And then you pay tax on your federal income tax. What their plan does is it eliminates your ability to deduct state and local taxes from your federal tax. So you pay your state tax, you pay your property tax bill, and then when you go to pay your federal taxes, you pay taxes on the amount of state and local taxes also. All right? That is especially devastating to New York because we have a very high property tax burden, as I've talked about many, many times. So it will eliminate your ability to deduct that property tax bill and that state income tax bill from your federal taxes. On average, in Western New York, the average federal tax right now is $7,500. That's what the average person pays in Western New York. If this plan goes through, the average federal tax bill will go up to $10,500. So it is not a small increase. It is a major, major increase. Now, we've gotten down state taxes. We're working very hard to get down property taxes. Just this year, we started with having the counties work with their local governments to come up with shared services and ways to get that cost down. Your county executive, Mark Poloncarz, has done great work. But our property taxes are still very high, some of the highest in the nation. Downstate, Nassau and Westchester pay the highest property taxes in the country, period. But upstate, as a percentage of home value, we have the highest property taxes in the country. So when you disallow the deduction of the state and local taxes, you hit this state right where it hurts. And it would be devastating to New York. Now, I know a lot of what they're doing on the federal level is what they call shopping for votes. I was in the Clinton administration, and when you have to pass a piece of legislation, you find ways to appeal to enough members so you get to 51, right? It's the rule of 51. Not that we do that in Albany, because we pass everything unanimously. But they're trying to get to 51. Eliminating state and local helps in some states, but it's devastating to states like New York and like California, which politically I think are states that they have written off politically. But this would really not only cost New Yorkers more, it would hurt the competitiveness of New York, because it would raise taxes for every individual and for every company. It's the exact opposite of what we've been working to do in New York for the past 6 years. We sit there going through the budget line by line, trying to reduce spending, and we have reduced spending in New York. We have the lowest spending increases in recorded history in the state of New York. Our budget goes up less than 2% year to year. It's the first time that's happened in recorded history, okay? Budget used to go up 5%, 6%, 7%. Under Governor Rockefeller, it went up 11% every year. So we have our state spending down. And we're making progress on the property taxes. We have a 2% property tax cap now. But this, in one strike of the pen, will reverse all that progress, raise taxes for individuals, and make us much less competitive for businesses. When Howard Zemsky goes out and is courting business, one of the questions is always, well, what's the tax structure in New York? And this will make our taxes higher relative to the other states. I'm going to say to our congressional delegation, you have to do whatever you have to do to stop this. I don't care if they have to filibuster until the session ends. I don't care if they have to lay themselves down on the Senate floor and refuse to move, but this would really be devastating to the state of New York. The other provision that we're watching on a federal level are the cuts to health care. Now, the Graham-Cassidy bill, which was their main health care reform bill, seems to be dead for the moment. I say for the moment because their health care bill has been the Lazarus Project. It dies, rises from the dead. You shoot it again, it rises from the dead. The Graham-Cassidy health care bill would have been devastating to New York. But there's another health care cut, which is called the DISH program, Disproportionate Share Hospital, a payment that goes to the state for hospitals that serve uninsured or underinsured patients. That goes into effect October 1, unless there is an affirmative vote to stop it. If those cuts go into effect, it hurts states that have a high percentage of Medicaid patients. We have a high percentage of Medicaid patients. And it would cost New York State about $1.1 billion over the next 18 months. New York State starts with a $4 billion deficit. We have no way to make up a $1.1 billion cut. Over the next 5 years, it's like $2.5 billion. So these are both very, very troubling issues for the state. We've worked very hard to get our finances in order. As I mentioned, keeping state spending down, cutting taxes, attracting more businesses. And these would really hurt the state, hurt the people of the state, and hurt the competitiveness of the state. So on the DISH cuts, which go into effect October 1, unless there's an affirmative vote to stop it, I urge our congressional delegation to stand up with one voice and make sure they are stopped, the dish cuts. And the quote-unquote tax cut plan, it's very simple. In New York, it is a tax increase, period, on the numbers, because of that provision on eliminating the deductibility of state and local taxes. This is not the first time they've tried to do this on state and local. Under President Reagan, they tried to do the same thing. My father was governor at the time, organized the governors around the country, and they were successful in stopping it because it is so targeted and it is so punitive. But here, they've sort of launched it as a silent and quick attack, but we have to mobilize quickly because it really, really would hurt the people of the state. Just think about the impact on Western New York. Average payment is now $7,500. It would go to $10,500. That is a big, big deal. So it's something we have to organize against. Today, specifically, besides that, we're here to talk about drugs. Again, drugs are a scourge that we have been living with all my adult life. I've fought it in one way or the other. Most of the people in this room have. And we have two specific drugs that we're taking specific action on. One is K2. K2 is a synthetic marijuana. It started in earnest about 10 years ago. I was Attorney General at the time, and it's a synthetic marijuana. It is a chemically created marijuana sold in packages that are very appealing to kids, sold in small grocery stores, sold in gas stations, and it is very, very dangerous. And since it's synthetic, what they have been doing is we outlaw one chemical compound and they tweak it slightly, so now it's another chemical compound just as dangerous, but it technically isn't illegal because it's a different chemical composition than the first one. On K2, what we want to do is pass a law with the help of our friends in the legislature that adds K2, synthetic marijuana, and 35 derivative chemical compositions, just to tighten the law so they can't get around it by just tweaking the formula somewhat, and then they say they're not eligible for prosecution because it's a different chemical compound. K2 is nothing new, and we have made good progress on K2, but now we have another drug that is even more dangerous and more deadly than K2, which is fentanyl and synthetic fentanyl. Fentanyl is a prescription pain reliever, and people can be prescribed fentanyl, and it's an effective pain reliever. However, drug dealers have now come up with a synthetic fentanyl that they mix with heroin or cocaine. It is extraordinarily dangerous. Much more dangerous than K2, much more dangerous than heroin. The numbers are frightening, where it takes about 30 milligrams of heroin to have a fatal dosage, potentially fatal dosage, 30 milligrams of heroin. Synthetic fentanyl, 3 milligrams can kill you. So if you are a first-time user and you don't know about this drug, it is literally very easy to kill yourself. You ask the police in Erie County today, you ask the police all throughout the state, and they will tell you it is fentanyl that they're fighting. and it is fentanyl that is killing our young people. It's fentanyl that's sending people to the hospital, and it is on the rise. What we want to do with fentanyl is, when we get back to Albany, I'm going to ask the legislature to pass a law that makes synthetic fentanyl illegal and 11 derivative compounds of synthetic fentanyl, because they're doing the same thing with fentanyl that they're doing with K2. You list one chemical composition as illegal, and they go back to the laboratory, they tweak it a little bit, and now it's a different compound. But all 11 are derivatives of the same thing. They're all killers, and they are all illegal. I would like to add them to the Schedule 1 drugs, which means they're felonies and punishable by up to 20 years. Again, because they are that dangerous. Also, in regards to fentanyl, it is so potent that it takes 5 times the dosage of Naxoline to save a life. Naxoline is a drug that we use when a person is overdosed on heroin, and it has saved thousands of lives. The state has trained people on it all across the state. We provide it with police officers, EMS workers, etc. And if a person overdoses on heroin, a shot of Naxoline can actually bring them back and save their lives. It takes 5 times the dosage if the person took synthetic fentanyl. To compound the matter, the insurance companies currently don't cover 5 dosages of Naxoline. So if the police administer it or a hospital administers it, they do it at their own cost because it's not covered by insurance. We're going to put out a state insurance, what we call circular, a regulation, that says 5 dosages are reimbursable under the insurance law in the state of New York, because if a police officer wants to save someone's life, they should have that ability and shouldn't have to worry about paying the cost of the drug itself. And we'll do that, and we will do that immediately. To give you an idea of how bad drugs are now in the United States, because people I think sometimes get a little jaded that, well, you know, we've always been fighting drugs and it just goes on and on and on. It's worse today. 64,000 people in the United States will die from drug overdoses. How high a number is that? 64,000 is more people than died from HIV/AIDS in the peak year, who die from gun deaths in the peak year. 64,000 is more people than died in the Vietnam War, Iraq War, Afghanistan War combined. That's what we're now losing per year. That's how serious it is. 78 people die every day in this country from the opioid crisis. So it's serious, it's getting worse, it's overwhelming the police, it's overwhelming the healthcare institutions, and this fentanyl and synthetic fentanyl is now the tip of the spear, and it is the highest growing problem. Last point is, well, the police have to do something about it. Fighting drugs is up to the police. Yes, fighting drugs is up to the police. And today is about giving them the tools to do it. So when the Erie County Police or the Buffalo Police go out, or the sheriff goes out, they can make an arrest for synthetic fentanyl, for synthetic K2. District Attorney Flynn can now prosecute, and he'll have the law. But it's not going to be just the police. It really is all of us. These drugs are so highly addictive, and they're so easily accessed, and they're so potent in small amounts. It is all of us. And I can't tell you how many parents, how many friends I've heard from who say, you know what? I knew something was wrong. I didn't say anything. I knew something was off when I saw him or her. I just didn't say anything. This is all of us. Parents, friends, cousins, aunts, uncles, school teachers. It's not like a drug in the old days where it gets progressively worse and it's months and you see months of deterioration. A young person can lose their life in 3 days here. They can lose their life on the first time they try one of these drugs. As a parent of 3 young ladies who I like to think went through their difficult years, they're now 22, 22, and 20. Sometimes I think they're still in the midst of their difficult years. But, you know, how does a parent fall asleep at night when the child is late or the child hasn't called or the child is past curfew? You say to yourself, well, this wouldn't happen to my kid. You know, my kid is a good kid and my kid hangs out with good kids. This wouldn't happen in my neighborhood. This is somebody else's neighborhood. Not with these drugs. Not with these drugs. These drugs are in every neighborhood in the state. They're in poor communities. They're in affluent communities. They're in affluent high schools. They're all across the state. Erie County has one of the highest rates of opioid abuse outside of New York City. So it's your problem. It's my problem. It's every parent's problem. And it is fast, my friends. I can't tell you how many parents have lost a child in a number of days. They go to the wrong party. Someone gives them the wrong drug to try to be cool. 3 milligrams is nothing. If you look at 3 milligrams on a piece of paper, every instinct would say, well, it's so small, it can't make a difference. It can make a difference between life and death. We're going to pass the laws. We're going to give the police and the prosecutors the power they need. But it's an effort that each and every one of us has to be involved in. And that's the message for today. With that, I turn it over to our great county executive, Poland Cars. Thank you.
Thank you, Governor, and thank you all for being here. As the Governor so eloquently put, we know the crisis that we're facing in Erie County, in the state of New York, and it is across the entire country. There are so many faces of the opiate epidemic. It is sad, and unfortunately, all you have to do is open up the newspaper and look at the obituary column, and you'll see another face of the opiate epidemic, because it is destroying lives, it is destroying families and communities. In Erie County, we unfortunately are still trending to an average of 1 death a day as a result of an opiate overdose. And to tell you, compared to other communities of similar size that have been hit hard, we're actually doing better. But every death that we have is 1 death too many. As many of you know, I've been touring the state for the last few months, taking the information I've learned with our health commissioner, Dr. Gail Burstein, and discussing what local governments can do to address the opiate epidemic. And just as things are bad here, they're bad in other parts of the state too. And sometimes their per capita death loss is actually worse than ours. And we're even talking about rural communities where they haven't dealt with this stuff before. But the one thing that I have repeatedly heard from law enforcement in Erie County, from law enforcement in the southern tier, from law enforcement in the Hudson Valley, is we need to have these fentanyl analogs made illegal. They need to be on the Schedule I list, as the governor noted. Whether it's District Attorney Flynn or district attorneys across this state, they all say the same thing. These fentanyl analogs are killing people, and they need to be made illegal. Now, the state can't, I mean, the localities can't do it, but the state can. That's why it is so important that the governor made the announcement today with regards to these analogs. As the governor noted, they are so deadly. And when we talk about 3 milligrams, sometimes all we're talking about is 5 or 6 grains of fentanyl in these analogs because they are so potent. So on behalf of the people of Erie County, I want to commend the governor for this piece of legislation that he's proposing, because it is so desperately needed across New York State. And I have quite a number of members of the State Assembly and Senate in front of us, and I will ask for you to do what I know you will do, which is to pass this legislation because it is so needed. It really will make a difference in allowing our law enforcement personnel, from our state troopers to those who prosecute, as well as our Erie County Police Departments, do what's necessary to get these drugs off the street. Now, the governor noted that there's going to be 11 analogs that are on this list that will be made illegal. And I need to give a shout out right now to our partners in Erie County government from the Central Police Services Crime Lab, as well as our Department of Health and their toxicology lab. And we're joined by Central Police Services Commissioner Jim Jansowitz, the head of our crime lab, Michelle Schmitz, as well as, of course, Dr. Burstein from the Department of Health. Because of those 11 analogs, 2 were actually identified in the Crime Services Lab here in Erie County. They were not identified in New York City. They were not identified in Atlanta. They were not identified anywhere else in the United States. But because of what we've been doing here and dealing with, they were identified here in Erie County, and it just goes to show the tremendous work of so many people in our community, faces and names that people don't know of that are fighting the opiate epidemic every day, and I want to thank them specifically for the work that they've done, and thank you, Governor, for listing those 2 analogs of the 11 that are going to be made illegal. It does take an entire community to fight the opiate epidemic. It's as simple as that. We've been fighting it for a number of years now, and we're going to be fighting it for years to come, because unfortunately there are so many people who are addicted that we need to provide them services in our greater community to eliminate that addiction. We also need to focus, as the governor has, as well as the state Senate and Assembly through the legislation that they passed last year, to assist with treatment, to assist with prevention, to assist with education. There is no one answer out of the opiate epidemic. But this is an action that needs to be taken and hopefully will be passed into law as soon as possible. It will make a difference. It will allow our law enforcement personnel, as well as our prosecutors like John Flynn, to do what needs to be done, which is to hold those responsible for selling the drugs and put them behind bars so they cannot kill other people. When 5 or 6 grains of a substance can kill an individual, as the governor noted, all it takes is the first time the person has ever taken it, not knowing what's in there. As our health commissioner, Dr. Gail Burstein, likes to say, there is no such thing as quality control when we're talking about the amount of drugs that are being placed on the street today. It might be 2 grains, it might be 20 grains. It's literally Russian roulette. We need to hold those responsible who are putting these drugs on the street. So thank you, Governor, for your actions. And at this time, it is my pleasure to introduce to the podium our chief enforcer of the law, prosecutor for Erie County, District Attorney John Flynn.
Good afternoon, everyone. Thank you, Mark, and thank you, Governor Cuomo. This is an important step forward in the fight against the opioid epidemic. Fentanyl is a growing menace that has exacerbated the current opioid crisis. This drug is lethal. It is spreading and is increasingly laced in other substances taken by unsuspecting users. As a member of the law enforcement community, I have seen the devastating and tragic consequences of fentanyl. But until now, law enforcement in New York has not been fully empowered to crack down on this substance. Without the appropriate legislation, police officers in New York have been hamstrung in our efforts to target major drug dealers who are putting our residents and our communities at risk. That is why we are grateful for Governor Cuomo's announcement today. By calling on a legislator to classify all forms of fentanyl and similar drugs as controlled substances, Governor Cuomo is giving law enforcement the legal grounds we need to do our jobs and protect New Yorkers. In short, these actions will ensure law enforcement can do their job and play their critical role in the comprehensive effort to stop the spread of fentanyl and end the opioid epidemic. I want to thank Governor Cuomo for his leadership and look forward to continue working with him to bring an end to this epidemic. And finally, Governor, as the Erie County District Attorney, I thank you greatly for this. But more importantly to me, as a father of 5, I can't begin to thank you. So thank you all for coming, and have a good day. Thank you, Governor.